welcome to #OurDocTalk. This is NorthBay Healthcare's way of reaching out to the community to answer questions on important health issues. With us is NorthBay Healthcare's Chief Medical Officer, Seth Kaufman, who is also an emergency room physician. Thank you and welcome, Dr. Kaufman.
Thanks, Robin. Good morning, everybody. Thanks for joining. Today's topic, always happy to answer any of your questions, but today's topic is we're going to discuss the elderly population. So those 60s, 70s, 80s, higher, and why we are so concerned about that population. I'm going to spend, like I've done in previous sessions, I'm going to spend a few minutes with some introductory comments, and then we'll go right to questions. I want to talk today about why we are concerned about the elderly population, how we keep that group healthy, and the biggest question, most common question I get is, what if I need to care for somebody who is elderly? How can I do that in a safe way? So those are the three agenda items for the introduction, and then we'll go right into your questions. So why are we concerned about older people and COVID? So what we know is that absolutely similar to flu, COVID-19, the coronavirus, affects old people more. So they have much more severe illness and are at higher risk for death. Robin right now is going to post a chart. It's out of the LA Times, but it's the California Department of Public Health data. And what you'll see on there, if you pop it up, is that the distribution of cases is fairly even. Actually, it's not. We have higher rates of COVID-19 in younger adults, middle-aged adults. But then if you look, and that's on the left side of that chart, the left side of that screenshot. If you look at the right side, which shows the death rates, it's much higher in older people. 80% of our deaths are related to the elderly. And that's fairly similar to what we're seeing that's California data. That's fairly similar to what we're seeing in Solano County. As of yesterday, there were 617 cases in Solano County. About 30% are 65 and older. About 30% are 65 and older. And we've had 23 deaths. 80% of those 23 deaths are older or elderly people 65 or older. So really concerning, really concerning. So the goal is to keep that population healthy. And as a side note, of those deaths and those cases, a lot are in our nursing facilities. What we call nursing facilities in other areas where you are living close together, a congregate living facility, That population is at even higher risk. Here at North Bay, we've instituted a nursing facility screening program. We've partnered with Kaiser and with Solano Public Health, our county colleagues, and we are going around and testing and screening our nursing facilities. It's been wildly successful, and it's a way to identify cases early. We have had a lot of success, and we're going to continue to do that. We even got a grant to test our nursing facility patients. Okay, so the next question is, how do we keep our elderly patients, our elderly family members and friends healthy? I want to start with a story. So I have several elderly family members. I have a mother-in-law who's in her 80s who lives in the Bay Area, and I have parents who do not live in the Bay Area and are in their 70s. There's diabetes in my family. For my mother-in-law who's in the Bay Area, our goal is really to try to keep her connected. It's very hard. And I'm sure for those of you, whether you're elderly yourself or whether you're caring for somebody or you have family, it's really hard to stay in contact when we really should not be seeing too much of them, or the instructions are really to quarantine, keep separate, things like that. A reminder that social distancing is not the same as social isolation. So we are absolutely, social distancing avoids transmission of COVID, but that doesn't mean we have to socially isolate ourselves, especially from our elderly family members. Emotional health is really, really important, and we're going to get into that. So As an example, for my mother-in-law, we went over to her home. We were super careful with masks and hand hygiene and did our best to socially distance. And we set up FaceTime for her. She didn't know how to do it. And we set up FaceTime for her. We set up the contacts, so it was really easy for her to use an iPad and to reach out to us. And that allowed us to have regular communication with her beyond the phone. We've also been able to get her out and go walking around the block and go on little walks and keep our distance and obviously practice all the important ways, hand hygiene, face mask wearing, and keeping our distance as best we can, and to be able to actually interact with her. And that promotes health for everybody, but today we're talking about the elderly population. That is a way to keep everyone emotionally and physically healthy. So a reminder then, and an ask in this, if you are an elderly person or you're caring for somebody who is elderly, actually let me take that back. Let me start over. If you have family members or friends who are elderly and you want to see them and do things with them, let's set up FaceTime. Let's make sure we're having outside visits in the backyard, go on walks and hikes, and just maintain those transmission precaution steps: hand hygiene, face mask wearing, and social distancing. And that is a way to keep everybody healthy. That does move into topic number 3 for today, which is, what if I need to care for a family member? So that's beyond visits and checking in. What if you actually need to care for that person, feed them, do things? I get that question a lot. And I get the question of, should I get tested? A month ago, I would have told you that testing is hard to come by, and we need to focus on those with symptoms, and not necessarily recommend testing for those who need to care for an elderly person. Today, I'll tell you, absolutely get tested. Absolutely get tested, and get tested on a regular basis if you need to continue to care for that person. Remember, testing, whether it's antibody testing or which is a blood test, or the swab the swab tests are just a single point in time. It tells you data from that exact moment, and so it's really hard to be 100% that you don't have the disease or you haven't had the disease. It's very, very difficult. But with that in mind, the key is to get tested as close to your visit as possible. And then between getting the test done and seeing and caring for that elderly person, that you really are extra diligent in isolating yourself, quarantining yourself, keeping your distance, hand hygiene. You should be going out to restaurants or things like that during that time. Just be extra, extra diligent. If you get a swab test and it comes out negative, and you're as close as you can to the visit, and you're really careful in that in between time, you could be fairly confident that you likely don't have the disease and you're not going to pass it on to the person you're taking care of. If you're getting antibody tested, and that's a bigger discussion, if you're getting antibody tested, there are several kinds of antibodies that we test for. It's fairly simple to get antibody tested these days. There's blood. You can go to the big labs. Your doctor can order it. And that will also give you some picture of whether you've been exposed or if you possibly even have had it recently. But if you come out negative, likely, not completely, but likely you've never had the disease or been exposed to it. And we are going to talk about that more next week. So next week's topic is about testing. It's about testing. On that note, so there's 3 big things I want you to remember from this talk, and I really have a few asks in there. Okay? Number 1, we have to be extra cautious and careful with the elderly population, right? So maybe younger adults, middle-aged adults are getting COVID more often, but it's the elderly population that get very sick from it. So we're being extra careful with hand hygiene, mask wearing, and social distancing. But if you're trying to keep yourself healthy and you're elderly, or you have family members or friends that you like to visit or want to stay in touch with, absolutely do it. Social distance does not mean you have to socially isolate. Get in the backyard, go on walks, go visit, set up FaceTime for them, Go grocery shopping for them. Do things to interact and stay in touch. It promotes health. Lastly, if you are taking care of somebody, you're forced to be within 6 feet of them, and you have to. Regular testing, I would recommend regular testing at this stage. Of course, you should also be monitoring for your symptoms. So, of course, if you develop any symptoms at all that possibly could be COVID, you should not be caring for anyone. You should be isolating yourself. But assuming that you don't have symptoms, regular testing is a great thing to do to give some reassurance, not 100%, that you are safe to care for them. I hope to go and see my own parents soon. My goal is likely to get tested fairly close to during that visit, and I'm going to try to interact with them, hang out with them, and just be very careful with my social distancing and mask wearing and hand hygiene. Lastly, Robin is gonna right now post a website. It's a program out of UCSF called Prepare for Your Care. It's a really nice website. There's very simple steps in there and videos that talk about setting up advanced directives, asking the right questions to your doctor. Essentially, it allows families to discuss care for your elderly elderly family member or friend if you're involved in their care, and how to really be proactive and prepare in the event that the person becomes ill. Prepare for Your Care. It's a website. Take a look at it. Watch some of the videos. You can see it has steps set up to set up advanced directive. It's run by geriatricians. One of the founders is UCSF, and it's a really nice program. Okay, Robin, I'm ready for questions.
Okay, so somebody just posted a question. Why are elderly more susceptible? Do the elderly have more health issues, or is there an immune system different than yours and mine?
This is not completely known, so I got to tell you that. Not completely known. The elderly population is at risk even if they don't have the other illnesses that we worry about with flu and COVID-19, diabetes, lung disease, heart disease. But overall, the opinion is that the immune system is not as strong, and many do have heart disease, lung disease, and things like that. So not completely known. There's concerns around immune system being a little more compromised, and many on top of just many, in addition to just being of an advanced age, also do have some of these other illnesses that place them at higher risk for illness. But yes, there are concerns around a compromised immune system or a less strong immune system in the older population.
Okay. So what can seniors do for themselves, and how do they take care of things like, for instance, if they need to go to the doctor and be out and about?
Really good questions. So, as I said in the introduction, by the way, our elderly people in Solano County, our elderly individuals, should be out and about a little bit. Does that mean, going to areas where there's other people a lot? No, but it's really important to keep your emotional health. Go on walks, go do things, be outside a little bit, things like that. Keeping yourself healthy, number one, is what we're all doing. Really being really diligent with hand hygiene, mask wearing, and keeping your distance from others. Number two, when you're out, you're going to really try to keep your distance. There's places that are open now that don't make that possible. Markets are very difficult. Everyone's doing their best, but anyone on this call, in the session who's been to a market, which I'm sure almost everybody has, or many have, know that it's almost impossible to 100% of the time stay 6 feet away. So I would not recommend that our elderly individuals, elderly community, go to areas where they can't 100% control that 6 foot rule, the mask wearing rule, and the hand hygiene rule. So I would have others go to the market for you if possible. Absolutely have others go to the market for you if possible. And then leverage technology. Order things online. Interact with people online. Those are my recommendations. Stay away from vulnerable, stay away from environments that place you at risk. like indoors and markets, and keep yourself healthy by being outside, keeping your distance, and following the general rules for transmission precautions.
Okay, so why, at what age are people considered elderly?
At what age are people considered elderly? That is a good question. There's the data, which often uses 65 as a rule, although there's smaller, it's sliced up in different ways. That we often talk about physiologic age. Somebody might be 75 years old, but they have a body and physiology of a 50-year-old. So there really is when it comes to clinical medicine, we are often thinking about the clinical age of that person. How healthy are they? But if you look at data, we are often talking about 65 or older, and then often slicing up also kind of the elderly at 80. Beyond that, I don't know any other legal definitions around that. But we absolutely, there's a full, it's really about how healthy you are, and not necessarily your, physical age.
Okay. And so if someone tests positive for COVID-19, what's involved in tracing their contacts, and how far back is that traced?
Yeah, so our county colleagues, Solano Public Health, has a contact tracing program. NorthBay is in partnership with them. We do some of the investigation for our hospitalized patients, although we will be expanding that program. The county does contact tracing for anyone who has COVID-19. That involves calling family and trying to trace back as far as they can for a period of time where they consider the person infectious. So that's how far back they go. I know it's dynamic right now, and I'm not sure if there's a fixed amount of time back that they go. I know they go back as far as they can to try to contain the disease. So they'll talk to their employer. Obviously, the person who's positive knows exactly what's happening. Talk to family members. That's a good reminder, by the way, that most of the cases we're seeing are clusters, family clusters, some work-related clusters. We are not seeing a lot of cases of people who are wearing their mask, keeping their distance, doing good hand hygiene, just getting it on their own. It's generally been family transmission and some work-related transmission. And in many of those cases, it's honestly breaking the rules, not doing the mask, not completely, but not doing the mask wearing, not doing the hand hygiene, we know about hand hygiene all the time, and not, more importantly, not doing the social distancing. So we're seeing a lot of clusters, which is why contact tracing is so important.
Okay. So I have an older friend who went to visit friends for a barbecue, and I suspect none of them wore masks or practiced social distancing. He's healthy, they're healthy, so it appears. Should we refrain from seeing him for a couple of weeks?
That's a really good question. And the answer is that's a very high risk environment, and yes, you should probably refrain from seeing that person at least as much as you can. It's always about like what needs to happen. Does that person need you to be there for some reason? Otherwise, I would keep my distance. If you go see that person and they're not symptomatic, so they're not coughing, they don't have a fever, and you keep 6 feet away and they're wearing a mask, you're probably, even if they have it, they're probably not going to transmit it to you. In other words, if they're wearing a mask, even if they got it from that barbecue, likely you're not going to get it. But the safest thing is true, to stay away from that environment and stay away from that person. And for a few weeks, if possible, stick to FaceTime and calls. And if you need to see them, absolutely, they should be wearing a mask. You should be wearing a mask, and you should be staying 6 feet apart. And a reminder, what you're describing is why we'll continue to see an increase in cases across the world. And what we're seeing across the country in California is a rising number of cases, and many of us believe it's because of what you're talking about. Barbecues where we're not keeping our distance, not wearing masks.
Okay. So what if your elderly loved one is in a skilled nursing care facility? What should we be looking at? What steps should we take to be safe? And how do you know that facility's safe? and any advice you have on that.
Sure. Our nursing facilities in Solano County have been amazing putting together, getting their PPE, so personal protective equipment, set up, partnering with the county, partnering with NorthBay and Kaiser and other systems to keep the patients safe, to keep their staff safe. So the first thing to do is talk to their leadership. I know in every facility, whether it's the nurses and the administrative leadership, want to talk to families, tell them what they're doing. So the first thing is reach out. What are you doing? Is my family member doing okay? What steps are you taking? And they'll tell you all about the regular testing and